Chapter 30. Okay, this is respiratory tract disorders, upper respiratory, we're focusing on. So, key terms, learning objectives. We're in page 556, it starts. Your learning outcomes again. Okay, epistaxis. I always have a hard time with this. Excuse me. This is known as a nosebleed, right? So this can be very common with allergies. The dry area that we live in, a lot of people are susceptible to nosebleeds. So it can also be from trauma. So from being hit, the nose is very sensitive, right? How do we help to get that? We want to clot it, and then hypertension, hemophilia, medications. These are other things that can be the causes of some severe nosebleeds. Okay. Positioning, yes, direct ice, pressure with ice. Nasal packing, if it's very severe, they'll put a nasal balloon in, something to vasoconstrict, or use a cautery and like burn the area so that it can stop the bleeding. Okay. Polyps, they're usually benign in the nasal cavity. They can occur often with allergies. These are very popular again in our area of Southern California. So the best thing to do with the chronic allergies is to stay on top of them and not let them develop into more serious sinus infections where they can cause different anatomy issues, like polyps develop. It gives them trouble breathing, that type of. Oh shoot, what did I do? Sorry about that. Okay. Deviated septum. Okay, so this is a stuffy nose, blocked signage, drainage, headaches you can have from this. It's not an uncommon thing. You can have a nasoplasty. They'll do surgery to correct this. Any excess swallowing, monitor the dressing, that type of thing. Sinusitis are very, very common. All of my life I've been having allergies living here and being an outdoor person. You might have the same experience, so you might be able to identify with this very easily. They can cause other challenges, but if you stay, again, plenty of water, things like nasal sprays, like over-the-counter saline sprays, keeping the area moist, those mucous membranes. You don't want bacterial or inflammation happening of that area, then you can get sinusitis from that. Pain and fever, I've had this as well, is horrible. Okay, so those are some of the things they can give you, and that's just pretty basic. Sleep apnea, another very, very common respiratory disorder, upper respiratory disorder. You see a lot of people that have sleep apnea. This goes along with obesity, a high palate, receding mandible, and or smokers. So this is they have very loud snoring often, and they stop breathing, so they have to get a machine to help them with that will give them a continuous sleep because they're always tired. Okay, what are complications? Heart disease, hypertension. Our bodies suffer when they don't get proper sleep. So again, these are some of the things that I just mentioned that are on here. Signs and symptoms. What are the tests? They'll do a sleep study. You want to avoid sedatives, lose weight. Some people can't sleep without sedatives because they are so dependent because their sleep is so disturbed with sleep apnea. They can also do surgery. Okay, viral rhinitis. This is like the cold, common cold, sore throat. These are usually caused by these bacteria here: laryngitis, tonsillitis, influenza. You guys are very familiar with this. Get your flu shot. Now we'll be getting all kinds of flu shots. What are the symptoms? They're very generalized, right? But usually body aches, fever. We're now looking at COVID-19 new strain, and that's what viruses do. They evolve, right? So these are just some of the things that we use to learn. They're learning about it now, and they will develop things for that one, just like they have for the influenza. West Nile, Asian, these are just different viruses again. These are our nursing diagnosis options. Very big here, risk for infection. This is our life right now, consumption, right? Quarantine because of risk for infection. So even though this has been around for a long time, this is because COVID-19 is something new and they don't know a lot about it. It seems to be more easily transmitted, but still all the other bad things out there that happen from easily being transmitted. So your personal space is very important. Cancer of the larynx. Okay, so let's see where we're at in our textbook. Page 565. Okay, so these are some of the things that you're going to see. Our test that we're going to have done. This is therapeutic interventions, and a diagram here of where cancer for the larynx what we're talking about. It's very serious. So radiation, chemo, they might have to do surgery. What are we looking at for our diagnosis? It will be ineffective airway clearance, of course. Yes, pain. Verbal communication is impaired. All of these things here are something they're going to be going through. Okay, these are aids for speech. You can see these on page 567. These are your review questions if you want to go through these. It's a good idea just to do your little self-tests. I hope you said the 78-year-old. Yep. Okay, that is chapter 30.